Open your mouth and look at your tongue in a mirror right now. Seriously, do it. Because doctors who specialize in internal medicine are saying that the color, texture, and coating on your tongue after the age of 60 can reveal hidden diseases in your body that blood tests sometimes miss. And millions of seniors look at their tongue every time they brush their teeth without ever noticing the warning signs staring right back at them. Your tongue is one of the most remarkable organs in your body. It contains thousands of nerve endings, a dense network of blood vessels, and a surface that changes in real time based on what is happening inside you. For centuries, doctors in multiple medical traditions have used the tongue as a primary diagnostic tool, and modern medicine is now confirming what practitioners have known for generations. The appearance of your tongue can provide critical clues about the health of your heart, your digestive system, your immune function, your nutritional status, and even your risk of certain cancers. Here is what concerns me as a physician. Most seniors see their tongue every single day, but they never really look at it. They do not know what a healthy tongue should look like, so they cannot recognize when something changes. They see a thick white coating and assume it is normal. They notice their tongue turning an unusual shade and think it is something they ate. They feel a persistent burning sensation and tell themselves it will pass. And meanwhile, their tongue is trying to give them information that could lead to an early diagnosis and potentially life-saving treatment. My name is Dr. Michael Williams, and today I want to teach you how to read your tongue. It takes less than 30 seconds, and it could reveal something you and your doctor need to know. In this video, I am going to show you the 8 tongue changes that doctors say are most significant in seniors over 60. I am going to explain what each change is connected to inside your body. And I'm going to tell you which changes are harmless, which ones need a doctor's visit, and which ones require urgent attention. The 6th change on this list is one that many seniors have right now and dismiss as nothing, but oncologists say it should always be examined because of its potential connection to oral cancer. So please watch this entire video because your tongue might be the most honest health advisor you have. A healthy tongue in a senior over 60 should be pink, evenly colored, and covered with small bumps called papillae that give it a slightly rough texture. It should be moist, move freely in all directions, and be free of significant pain, swelling, or unusual markings. Anything that deviates significantly from this baseline is worth paying attention to. The first tongue change. I want you to check for is a thick white coating covering all or part of the tongue surface. A thin whitish film is normal, and usually consists of dead cells, food debris, and bacteria that accumulate naturally. But a thick, heavy white coating that does not brush away easily can indicate several conditions. The most common cause in seniors is oral thrush, which is a fungal infection caused by Candida. Oral thrush is particularly common in seniors who wear dentures, use inhaled corticosteroids for asthma or COPD, take antibiotics frequently, have diabetes, or have weakened immune systems. The coating from thrush tends to look like cottage cheese and can sometimes be scraped off, revealing red, irritated tissue underneath. Left untreated, oral thrush can spread to the throat and esophagus, causing difficulty swallowing and further complications. A thick white coating can also be associated with dehydration, which is extremely common in seniors, or with a condition called oral lichen planus, an inflammatory condition that creates lacy white patches on the tongue and inside the cheeks. If you see a thick white coating on your tongue that persists for more than 2 weeks, see your doctor or dentist for evaluation. Treatment is usually straightforward once the cause is identified. The second tongue change is one that should always get your attention. It is a tongue that appears unusually red, almost strawberry-colored, with a smooth, glossy surface. A bright red tongue in a senior often indicates a nutritional deficiency, and the most common culprits are vitamin B12, folate, and iron. When your body does not have enough of these nutrients, the papillae on your tongue can flatten and disappear, leaving the surface smooth and shiny, and the tissue becomes inflamed, turning a deep red. We talked about vitamin B12 deficiency in an earlier video, and the tongue is often one of the first places it shows up. A smooth, red, painful tongue, a condition doctors call glossitis, can appear weeks or months before other symptoms of B12 deficiency become obvious. If your tongue has become noticeably redder and smoother than usual, this is a strong signal to get your B12, folate, and iron levels checked through a simple blood test. Correcting the deficiency can resolve the tongue changes and prevent more serious complications like nerve damage and cognitive decline. The third tongue change is one that many seniors find alarming when they first notice it, but it is actually one of the more benign conditions on our list. It is geographic tongue. Geographic tongue creates irregular map-like patches on the surface of your tongue where the papillae have disappeared, leaving smooth red areas surrounded by slightly raised white borders. These patches can change in size, shape, and location over days or weeks, giving the tongue a constantly shifting appearance. While geographic tongue looks dramatic, it is generally considered harmless and is not associated with serious underlying disease. However, it can cause sensitivity to spicy or acidic foods, and it may flare up during periods of stress, illness, or hormonal changes. If you notice geographic tongue patterns and they are causing discomfort, avoid spicy and acidic foods during flare-ups, and mention it to your dentist at your next visit. No treatment is typically needed, but having it documented in your medical record is worthwhile. The fourth tongue change is a black or dark brown discoloration of the tongue surface, often with a furry or hairy appearance. This alarming-looking condition is called black hairy tongue, and despite its frightening appearance, it is usually harmless and temporary. It occurs when the papillae on the tongue grow longer than normal and trap bacteria, food debris, and dead cells, creating a dark, furry-looking coating. Black hairy tongue is most commonly caused by poor oral hygiene, smoking, excessive coffee or black tea consumption, use of certain medications including some antibiotics and bismuth-containing products like Pepto-Bismol, and dry mouth. In most cases, improving oral hygiene by gently brushing the tongue with a soft toothbrush. Staying hydrated and eliminating the contributing factor will resolve the condition within a few weeks. However, if the discoloration persists despite good hygiene, see your doctor to rule out other causes. The fifth tongue change involves sensation rather than appearance. It is a persistent burning or tingling feeling on the tongue that has no visible cause. This condition, appropriately called burning mouth syndrome, is more common in seniors, particularly in women after menopause. It can cause a burning, scalding, or tingling sensation on the tongue, the roof of the mouth, the lips, or the entire mouth. The discomfort may be constant, may worsen throughout the day, or may come and go unpredictably. Burning mouth syndrome can be caused by several underlying factors, including dry mouth from medications or salivary gland dysfunction, nutritional deficiencies in B12, iron or zinc, oral thrush, acid reflux that reaches the mouth, allergic reactions to dental materials or food additives, nerve damage from dental procedures, and diabetes. In some cases, no specific cause is found, and the condition is thought to involve nerve dysfunction, similar to neuropathy in other parts of the body. If you are experiencing a persistent burning sensation in your mouth, see your doctor or dentist for a thorough evaluation. Identifying and treating the underlying cause often resolves the symptoms, and even when a specific cause is not found, there are treatments that can provide significant relief. Now we come to the sixth tongue change, the one that I said oncologists take very seriously. It is a persistent sore, lump, patch, or thickened area on the tongue that does not heal within 2 to 3 weeks. Oral cancer is a serious condition that affects thousands of seniors every year, and the tongue is one of the most common locations for it to develop. Risk factors include tobacco use in any form, heavy alcohol consumption, chronic irritation from rough teeth or poorly fitting dentures, a history of HPV infection, and prolonged sun exposure for cancers of the lip. Early oral cancer may appear as a painless white or red patch on the tongue called leukoplakia or erythroplakia. It may present as a sore that bleeds easily and does not heal. It may feel like a lump or thickened area within the tongue. Or it may cause unexplained numbness or difficulty moving the tongue. The critical point is that early oral cancer is often painless, which means many people ignore it or assume it will go away on its own. If you notice any persistent change on your tongue, a sore that does not heal, a lump that does not go away, a patch that looks different from the surrounding tissue, or numbness that persists for more than 2 to 3 weeks, see your doctor or dentist promptly. Oral cancer caught in its early stages has a significantly higher survival rate than cancer diagnosed later. A visual examination and possibly a biopsy can determine whether a suspicious area is cancerous or benign. The seventh tongue change is one that provides a window into your cardiovascular and respiratory health. It is a tongue that appears bluish or purplish in color. A blue or purple tongue, called cyanosis, indicates that your blood is not carrying enough oxygen. Healthy, oxygen-rich blood gives tissues a pink color. When oxygen levels are low, blood turns darker, and tissues that are rich in blood vessels, like the tongue and lips, take on a bluish tint. In seniors, a blue tongue can be caused by chronic lung diseases like COPD or pulmonary fibrosis, heart failure that impairs the heart's ability to pump oxygenated blood, sleep apnea that causes repeated oxygen desaturation, severe anemia, or circulatory problems that prevent adequate blood flow. If your tongue appears blue or purplish, this is a symptom that deserves prompt medical evaluation, as it indicates that your body is not getting the oxygen it needs. The eighth and final tongue change is one that affects both comfort and nutrition. It is a severely dry tongue with cracking or fissures. While mild tongue dryness is common, a severely dry tongue with deep cracks can indicate significant dehydration, Sjögren syndrome, an autoimmune condition that attacks moisture-producing glands, uncontrolled diabetes, medication side effects from antihistamines, antidepressants or blood pressure medications, or chronic mouth breathing from nasal obstruction or sleep apnea. A persistently dry mouth and tongue is more than just uncomfortable. It increases the risk of tooth decay, gum disease, oral infections, and difficulty eating and swallowing. If your tongue is consistently dry and cracked, discuss it with your doctor. Identifying and addressing the underlying cause can improve both your oral health and your overall comfort. Now, let me teach you a simple monthly tongue self-exam that takes less than 30 seconds. Stand in front of a mirror in good lighting. Open your mouth wide and stick out your tongue. Look at the top surface for any changes in color, coating, texture, or patches. Then lift your tongue and look at the underside, which should be smooth with visible blood vessels. Check the sides of your tongue by moving it left and right. Finally, feel your tongue gently with a clean finger, checking for any lumps, bumps, thickened areas, or soreness. If you notice anything new or unusual, make a note of it and mention it to your doctor or dentist. Let me recap the 8 tongue changes we covered. First, a thick white coating possibly indicating thrush, dehydration, or lichen planus. Second, a bright red smooth tongue suggesting B12, folate, or iron deficiency. Third, geographic tongue with map-like patches, usually benign. Fourth, black or dark discoloration with a hairy appearance, often from hygiene or medication. Fifth, burning or tingling with no visible cause, pointing to various systemic conditions. Sixth, persistent sores, lumps, or patches that could indicate oral cancer. Seventh, a blue or purple tongue suggesting low oxygen levels. And eighth, severe dryness with cracking indicating dehydration, autoimmune conditions, or medication effects. Your tongue is talking to you every single day. It is time to start listening. If this video taught you something new about your health, please subscribe to this channel. I share new videos every week designed to help seniors recognize the signs their body is sending and take action early. And if you know someone over 60 who might benefit from checking their tongue, please share this video with them today. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Check your tongue and take care of yourselves.